Hello, I'm Nate Eaton with EastIdahoNews.com here at Family First Medical Center speaking with Dr. Boyd Southwick. He's a family doctor in Idaho Falls. And Dr. Southwick, kind of a big development this week in the vaccine for coronavirus, COVID-19. What do you know about it? Should people watching be optimistic about this? Is this the game changer?
Oh, absolutely. I'm glad you asked. From the very beginning, we felt like vaccine is going to be the thing that is going to help us get through this pandemic. But it takes a while to get a vaccine produced. And so with what Pfizer just recently announced, that it's a 90+% effective vaccine, that's really optimistic. Now, given it is preliminary data, there's still safety time that needs to be developed, but I'm very optimistic that what we're going to see is a safe and effective vaccine that can really help us get through this safely.
And that's what everybody, of course, is hoping for. It might be a few months away.
Oh, yes.
But at least maybe there's a glimmer of hope. So until then, what do we need to be doing?
The best thing that we can do is what our public health departments have said from the beginning, our scientists and doctors have been saying from the beginning, and that is social distancing, wearing masks, and washing our hands. There's a lot of good evidence, and it's common sense that these strategies really do help to mitigate the spread of this coronavirus.
You mentioned masks. We're, of course, wearing them here.
Yes.
And they've been recommended for several months now. I want to ask you, one of the things that some people make, the argument is that they can be dangerous, restricting your oxygen flow or building bacteria behind the mask. You're a doctor. What can you tell us about this?
So the two things about masks that we need to keep in mind is we want to make sure they're safe and they're effective. So from a safety standpoint, there have been some theories out there that because of the moisture that can build up inside the mask, that it can trap bacteria and viruses. What we found through the science is that's really not true as far as it causing you illness. You know, the bacteria and the viruses that you may expel that get caught in the mask are the same ones that were in you to begin with. They're not going to cause you infection. However, it's important that you wear the mask appropriately. So if too much moisture builds up, then you change the mask. You should launder the mask at the end of every day and change masks so you're not repeating that every single day. And on disposable masks, you also discard them at the end of the day. But wearing a mask all day long, the science has shown us that that's really not dangerous to your health.
And surgeons have been doing that for decades.
Oh, absolutely. In fact, if you look at many years, Asians have used these masks pretty commonly in public from a standpoint of outbreaks or sickness. Healthcare workers, as you mentioned, have been using them for so many years, for long periods of time, and there's been no health issues seen by doing that. And I've heard people say, well, people aren't wearing their masks correctly, and therefore if you fidget with them, you're touching your face, that makes it worse. No doubt we should try to remember not to touch our face, and so if you do, you should hopefully have some hand sanitizer with you that you can cleanse off your hands should you have to do that. But wearing the mask appropriately, covering the mouth and the nose, has been highly effective at decreasing the viral spread.
I think, and correct me if I'm wrong, numbers are highest right now in eastern Idaho than they've been, and the hospitals are getting to the overwhelming point.
Absolutely. So the numbers here, especially in Idaho and Idaho Falls, are the highest they've been since this pandemic started. And the concern is because of the rising numbers, we are running out of healthcare resources. We want to be able to take care of everybody. This is not just COVID. We have people all the time that have heart attacks and strokes and pneumonia, and they need to be hospitalized because of the severity of the illness. Well, unfortunately, we're running out of resources to be able to do that. In fact, recently I just talked to the CEO of ERMAC, and he said that not so much a bed space or a ventilator resource problem, but he said that our human resources, our nurses, are really tapped out. We're not having enough resources to be able to take care of people. So that's a real concern. So in order to then make it so that we have enough resources, we need to decrease the amount of sickness that's happening from this coronavirus. And this is our best way.
You've been practicing 15 years, 16 years?
17 years.
17 years. I'm sure you've never seen anything like this.
Oh, no. No, most people that are alive today have never seen anything like this. This is no doubt a huge thing that we've never been through this before. So we have to learn together about how we're going to do this. Some of the maybe mistrust that people have had in the medical profession is they feel like that things keep changing. But that's what science is. When we get more data, we then change recommendations based on that new data so that we can do it for the better health of the society and of the individual. And as we have evolved through this pandemic, we are finding more and more real good scientific ways to help combat the spread of this very infectious disease. You know, at the end of the day, Nate, we want to keep our schools open. We want kids to be in sports. We want restaurants open. We want businesses to stay open. We don't want the economy to suffer as it has. In order for the economy to continue to thrive and to open and thrive, we need to decrease the spread of this, and this is the best way we can do it. So I just urge people to wear a mask. It's inconvenient, it's irritating, no one likes to do it, but by wearing a mask, you basically say two things. One, I care about those around me, and two, I'm doing my part to help to decrease the spread of this very contagious disease.
Dr. Boyd Southwick, thank you very much.